How timely. Yes, sir.
Sorry to interrupt.
No problem.
We just got word that the mic is live right now, so you got to mute it. So
I thought I just turned it on.
okay. They just called us. So.
Okay, so it should be red now.
Okay. All right.
Beautiful. Thank you. It sounds like I'm hearing myself now. I hear him ringing. Ask him if it's mute now. Mute now. Testing, testing, 1, 2. Now I'm hearing myself.
Courtney, I think your mic might be on.
Test, test.
Turn yours off and on.
That's fine. That's fine. That's fine. Good afternoon. Thank you very much for coming and participating in today's really critically important, from my perspective, Budget Sub 1 hearing, our informational hearing on the federal deficit reduction and its potential budget impacts on California and the health and human services that we oversee here in the legislature. My name is Holly Mitchell. I'm the chair of Budget Sub 1. Would like to welcome and introduce my colleague, Assemblywoman Yamada from the 8th Assembly District, who is chair of the Aging and Long-Term Care Committee. Thanks for joining us today. Would like to welcome all of you advocates here in the audience and those who are watching on Cal Channel. As the state with the largest population and federal tax burden, it's appropriate for Congress members seeking to reduce the federal deficit that they understand the potential impacts here in California, that they are aware of the legislature's budget priorities, and hear our recommendations. Clearly, the most prudent priority at the federal level in the near term is not merely deficit reduction, but overall economic recovery and jobs until the economy is growing and unemployment is on a downward trajectory. In the coming budget year here in California, we will again face grave challenges as a state. As you'll recall, we eliminated 60% of the structural deficit this past year, in part by closing the gap with $11 billion in cuts, more than half of which came from Health and Human Services committees. The economic crisis that we're facing here in California has hit our families and children, the programs that they utilize, very, very hard. The share of Californians who have fallen below the federal poverty line is now over 16%. 2.2 million of California's children, nearly 1 out of every 4, have been living in poverty over the past year. 1 out of 4 of California's children. Given that reality, I simply cannot imagine the additional human costs of absorbing federal reductions to the programs these families need. So today's hearing has several related objectives. First, to educate all of us regarding the federal deficit reduction process and parameters of the Subcommittee that I'm sure you've all read about in the press, as I have. Secondly, to identify the potential fiscal impacts to California's health and human services programs and the human impacts on those they serve. Third, to define recommendations for the principles that we advise should guide the work of the Subcommittee. And finally, to focus on recommendations that encourage economic recovery, job creation, maintenance of critical health and human services programs, and the state's safety net for the most vulnerable among us. I want to thank all of the panelists, the tireless advocates, for their work to analyze and articulate their views on deficit reduction and fiscal impacts. Those who've prepared public testimony, those who are here today, and those who are watching on Cal Channel. Your attention to these developments is critical. Clearly, this can only be kind of the beginning of the conversation. There are a number of groups and special interests who also will be impacted and have a vested interest in this subject matter, and we simply couldn't accommodate everybody in our panel today. This would be a week-long hearing versus a hearing just one afternoon. We've received all your written testimony. There will be public comment, and so please know that this won't be the end of our conversation. You'll have plenty of opportunity to continue to inform us as we develop recommendations that we will forward to our members of Congress. I'd like to invite my colleague, Ms. Yamada, if you'd like to provide some opening remarks. I welcome them.
Thank you. Thank you, Chair. There we are. Thank you very much. Well, thank you very much, Chair Mitchell, for your leadership, continuing leadership in all of these important issue areas, and for always extending such a kind welcome to me to join you as a guest here at Budget Sub 1. I would just say at this juncture that we know that the Subcommittee, comprised of a dozen members of Congress, kind of gives, in my mind, the word playing the dozens a whole new meaning. And, while we may be able here to just wait to see what's going to happen at the federal level, it would be less responsible for us not to articulate in a very clear fashion what we see as our priorities and ensure that our delegation is well prepared to take these issues on our behalf to the deliberations. I know the time is short, and we know that it's going to be a cold winter ahead if we don't ensure that our voices are heard. So I just again want to thank you for your leadership. I know that your passion and your compassion will continue to carry us through. So thank you very much. Look forward to hearing the testimony.
Thank you very much, Ms. Yamada. We're going to go ahead and get started and ask our first two panelists to join us. We're going to have two panels today. Our panelists and the first panelists include Edwin Park, Vice President for Health Policy at the Center on Budget and Policy Priorities in Washington, D.C. Mr. Park will present an overview of the current deficit reduction process, options, and implications for states. He will be joined by California's own Gene Ross, Executive Director of the California Budget Project, and Gene will examine the federal process using a California lens. Again, that's our primary goal today, to walk away with a fundamental understanding of what the federal process is, acknowledging the tight time frame, and again, looking at it from a California perspective, recognizing the impact the federal decision can have on the state's ability to provide critical services to Californians. With that, thank you very much for joining us today. It's been great meeting you, and you can begin.
Thanks very much. I appreciate the opportunity to testify today. My name is Edwin Park. I'm Vice President for Health Policy at the Center on Budget and Policy Priorities, which is a nonpartisan research and policy organization based in Washington, D.C. Founded in 1981, the Center conducts research and analysis to inform public debates and policymakers about a range of budget, tax, and programmatic issues at the federal and state levels that affect individuals and families with low or moderate incomes. I'm here today to provide an overview of the federal deficit reduction discussions that are now underway, including the joint committee process set up as part of the Budget Control Act enacted on August 2nd to raise the federal debt ceiling and how they could adversely affect states like California. I'll first start by talking about why the federal government has such a poor fiscal outlook. As recently as 2001, the federal government was running large surpluses, and the Congressional Budget Office and the Office of Management and Budget were projecting surpluses for years to come. What explains the sharp deterioration in the federal budgetary outlook? Just two policies dating from the Bush administration, the 2001 to 2003 tax cuts and the wars in Iraq and Afghanistan, accounted for over $500 billion of the $1.4 trillion deficit in 2009 and will account for $7 trillion, or well over half, of the expected deficits between 2009 and 2019, including the associated interest costs. By 2019, these two policies alone will account for almost half, nearly $10 trillion, of the $20 trillion in debt that will be owed under current federal policies. Although the temporary policies adopted to stabilize the economy and the financial system during and after the recent recession added to federal budget deficits between 2009 and 2011, the effects will fade quickly thereafter, and they do not contribute much to the long-term budget shortfall. I'll now turn to how the Budget Control Act, which increased the federal debt ceiling, works. That act includes the following elements. First, it establishes binding limits or caps on annual federal appropriations bills, which cover so-called discretionary programs, things like defense, education, national parks, agencies like the FBI and the EPA, low-income housing assistance, and medical research. The caps reduce projected funding for these programs by nearly $900 billion over the next 10 years. Second, it requires the House and Senate to vote this fall on a constitutional amendment that would require a balanced federal budget every year. Third, it establishes a joint select committee to report legislation that would reduce projected deficits by at least $1.5 trillion through 2021 and creates a fast-track process for Congress to consider the committee's bill without any amendments. The committee was vote on legislation no later than November 23rd of this year and report to Congress by December 2nd. And I note that the committee has already begun meeting. Finally, it provides for automatic across-the-board cuts in many programs if Congress fails to enact Joint Committee proposals achieving at least $1.2 trillion in savings over the next 10 years. The automatic cuts would be triggered if the committee doesn't report the required legislation by the deadline, if Congress defeats the legislation, the President vetoes the legislation, the veto is sustained, or to the extent the legislation is enacted, but it doesn't reach the $1.2 trillion target. Those automatic cuts are known as sequestration among federal budget wonks. So how would a sequestration work? How would these automatic cuts work if they're triggered? If the Joint Committee process fails to produce legislation meeting the $1.5 trillion target, automatic cuts would take effect to achieve a total of $1.2 trillion in deficit reduction between 2013 and 2021. The first round of automatic cuts doesn't take effect until January of 2013, so about a year later. A number of so-called mandatory or entitlement programs are entirely exempt from these automatic cuts or sequestration. They include Social Security, as well as a host of low-income programs, including Medicaid, the Children's Health Insurance Program, SNAP, formerly known as the Food Stamp Program, TANF, CalWORKS here in California, SSI. Refundable tax credits such as the Earned Income Tax Credit, Veterans Benefit, and federal retirement are also exempt. Medicare is subject to these automatic cuts, but the maximum cut would be 2%, applying only to payments to healthcare providers and payments to private plans, but not to benefits. Assuming that no deficit reduction legislation is enacted at all, in other words, the Joint Committee doesn't report anything out, there would be an overall automatic cut of $110 billion in 2013. Defense spending would be cut by half of that amount, $55 billion. Non-defense spending would be cut by the remaining $55 billion. Now, of that $55 billion in non-defense cuts, $39 billion would come from non-defense discretionary appropriations through a 9.3% across-the-board cut. The remaining $16 billion would come from non-exempt mandatory programs, $11 billion from Medicare, $5 billion from across-the-board cuts of 8.3% to everything else, with the largest cuts occurring in farm price supports. Now, there are a few key points about this Joint Committee process I would like to highlight. First, the Joint Committee can report out any legislation that includes any kind of deficit reduction measure it wants. Further reductions in discretionary spending, cuts into any entitlement programs, including programs that are exempt from the automatic cuts, like Medicaid, and tax increases of any kind. Second, the Joint Committee reports out legislation that is enacted into law but falls short of the $1.5 trillion target. The $1.2 trillion in automatic cuts is reduced on a dollar-for-dollar basis. In other words, every dollar of deficit reduction they report out, even if it's well short of the $1.2 trillion target, reduces the automatic cuts by that same amount, so long as the total combined deficit reduction from what the Joint Committee reports out and what is done through the automatic cuts totals $1.2 trillion. Third, Congress at any point can always step in, block the automatic cuts, and substitute its own legislation, its own package of spending cuts and revenue increases before the automatic cuts ever take effect. Fourth, about one-third of domestic discretionary appropriations outside of Homeland Security goes in the form of grants to states and local governments. That means about one-third of the $500 billion in such cuts that were already enacted, that were part of the Budget Control Act over the next 10 years, are likely to be reflected in federal funding cuts to states and localities over the next 10 years. So as already mentioned, the Joint Committee could consider additional reductions to these appropriations, and the automatic cuts would also hit discretionary appropriations, and that would be on top of the cuts that have already been enacted. So that's obviously could be a big hit on states and localities. Fifth, the major Medicaid savings proposals likely to be considered by the Joint Committee would substantially shift costs to states. For example, two proposals related to provider taxes, the so-called blended rate, constituted the bulk of Medicaid savings that were considered during the debt ceiling negotiations between the President and the Speaker of the House. Now, I'll discuss these proposals in more detail as part of my testimony on Panel 2, but I note that states like California will have to compensate for these cuts either by increasing their share of Medicaid spending by a corresponding amount, or cut their programs by reducing benefits or provider reimbursement rates. And of course, that would be on top of the cuts that have already been made due to the budget shortfall states are currently experiencing. Finally, some Medicare savings proposals that are under consideration would also shift costs to states. For example, raising the Medicare eligibility age from age 65 to 67 would mean that Medicaid would become primarily responsible for the so-called dual eligibles age 65 and 66. Now, these are the low-income Medicare beneficiaries who also receive supplemental coverage through Medicaid. Now, moreover, because state Medicaid programs help some low-income Medicare beneficiaries with their premiums and cost-sharing charges, any increases in Medicare premiums and cost-sharing that would be considered by the Joint Committee would not only increase out-of-pocket costs for beneficiaries, which may not be affordable, but can also raise state Medicaid costs. Now, I'll conclude with some thoughts on some of the key principles we believe this Joint Committee should adopt in crafting its deficit reduction package in coming weeks. First, the Joint Committee needs to develop a balanced package. It has to include significant revenues to reach its target. Only by proposing substantial increases in revenues can the Joint Committee avert the automatic cuts in discretionary spending and harsh cuts in Medicare, Medicaid, Social Security, and other mandatory programs. Second, deficit reduction should not take effect until the economy is recovered. You don't want to use these cuts in the name of deficit reduction to undercut the already slow recovery. Third, the Joint Committee should seek to constrain healthcare costs system-wide in both private insurance and public programs like Medicare and Medicaid, not just merely shift them to states, individuals, and others. That's the approach the health reform law takes. It tests new ways to deliver health care that can improve health care quality and lower costs, which could be adopted throughout the U.S. healthcare system if they prove successful. Now, the Joint Committee should consider how to build on these measures to help slow healthcare costs throughout the U.S. system, though achieving large additional savings will prove to be difficult. It should avoid cost shifts, some of which would actually increase total health care spending, and as a result, it adds to the burden that health care already places on the economy. Finally, we believe very strongly that federal deficit reduction should not increase poverty and inequality. The burden for deficit reduction should not fall disproportionately on low-income individuals and families. The U.S. already has higher levels of poverty, higher levels of inequality than most other Western nations, and the new census data show these conditions have become significantly worse. The 46.2 million Americans who lived in poverty in 2010 was the highest number on record. 20.5 million Americans in 2010 were in deep poverty. That's those who have income below half the poverty line, which is only $5,400 for an individual, $11,200 for a family of four, and that was also the highest such number on record in deep poverty. These figures would have been much worse if it had not been for key federal programs, cuts to programs like unemployment insurance, food stamps, the earned income tax credit, which all help people stay out of poverty. If those cuts are made in the name of deficit reduction, that would already increase already too high rates of poverty and hardship in this country. So with that, I'll stop, and thank you, and I look forward to answering any questions you may have.
Thank you very much for outlining for us this complex, multifaceted, and very short-term critical project that the Supercommittee is engaging in. Ms. Yamada, you have any questions before we move on to Ms. Ross? Okay. Ms. Ross, help us understand the impact all of this could have on the state of California and its residents.
I'll try. Thank you. I'm Jean Ross. I'm the Executive Director of the California Budget Project, a nonprofit, nonpartisan public policy research group here in Sacramento. And I'd like to thank the subcommittee for taking on this very important topic and helping to focus attention on what these deliberations will mean for California. This is an incredibly important process in terms of the future, the programs under the jurisdiction of this committee, programs closely related that serve some of the same low-income and vulnerable populations in California, as well as the state budget as a whole. If you take that 1/3 of the $500 billion, I always have to remember to add a B and a T when we talk about federal numbers, that works out over the 10-year period to being, in rough terms, of a loss of about $1.5 billion for California. That's from the cuts that are already mandated. When you look at the cuts that would be required under sequestration, the across-the-board reductions, we're looking, again, for all programs that touch the lives of Californians, a potential loss of $3 to $4 billion dollars, some of which would flow through the state budget, others would flow to local government budgets and to individuals around California. So this would have a very significant impact in addition to the reductions that you have already made to help balance the state budget. What programs would be affected? Virtually everything that touches the state budget touches the lives of Californians, from the WIC program, which provides food supplements to women, infants, and children, to Homeland Security, to our public schools, health and human services programs, housing and community development, economic development programs, very significant impact on workforce investment programs, as well as our unemployment insurance administration and employment service, which helps the 12% of Californians of working age population who are out there unemployed find work. And so again, at a time when our economy still remains very much mired in what we're told isn't an economic downturn anymore, but is a very weak recovery, a very significant impact. The continuum of impact, and I know your subcommittee has talked a lot about how we're not dealing with individuals on just one area, but we're dealing with the same individuals and families across multiple dimensions, I think also bears particular attention. We are looking at reductions that would affect the WIC program that provides food to low-income families, Section 8 housing program, which may provide housing assistance to the same family, Head Start, or the Child Care and Development Block Grant, which provides access to affordable child care, early start, helping to get children ready for school, ready to learn. And then at the end of life, we're looking at programs that affect the elderly, and some of the dollars that have been used, in some cases, to backfill from some of the loss of state funds and provide critical services to older adults throughout California would all be affected by those reductions. In terms of dollars, the biggest cuts would affect Title I, some of the dollars that flow through to some of the lower income schools throughout California. Again, not directly related, but many of the same children that are touched on by the programs under the jurisdiction of the subcommittee. Special education, and I think this is particularly problematic in terms of the federal dollars that flow to the state and would absolutely be a cost shift to states because the federal mandate to provide those services would remain in place. And so states would be required to come in and make sure that students in special education still receive the education that they are guaranteed under federal law. The child welfare services, and again, we know when the economy is tight, when unemployment is high, when families are under economic stress, demands on that program increase as well. Substance abuse and mental health block grant programs, which are critically important as you move to implement the realignment of criminal justice and related services from the state to local governments, which I think was absolutely a positive thing to do. But those are some of the dollars that I think we're all counting on to make sure that individuals who will be in communities get the services they need to stay out of the criminal justice system the first time or to avoid going back into those systems when they come out for incarceration. Ryan White AIDS Grants Program, Family Planning Services, and Immunization. So again, it is virtually everything, all of our public health programs, clean water programs, and others. The magnitude of the impact due to the sequestration or the across-the-board cuts that will occur if the Supercommittee doesn't come up with a substitute proposal for the domestic discretionary spending, non-defense discretionary spending would be equivalent to about a 9.3% reduction in spending for those programs. There is still some lack of certainty with respect to what baseline would be used. Our understanding is that the cuts will have to meet a certain scoring target, but in part because Congress is yet to pass the appropriations bills for the upcoming federal fiscal year. In some areas, we don't know exactly what that baseline number might be. And in some cases, that's particularly concerning because of the large reductions that are on the table. And I circulated a paper, actually, that Edwin's organization drafted, looking at the potential impact, for example, of cuts that are under consideration to the WIC program that could reduce the baseline, reduce the number of individuals served by that program by over 100,000, which means that when the sequestration reductions would kick in, it would start from an already diminished baseline. A couple of examples just to try to bring these big numbers down to the California level. California receives different percentages of different funding that is distributed to the states. In WIC, for example, community development block grants were up around 17% of all dollars nationally. Some other programs, we are down in the sort of 10 to 12% range. If you look at the potential across-the-board reduction to the WIC program, we're looking at something in the range of $100 million a year. Just doing some back-of-the-envelope calculations relative to current funding level, that's 135,000 fewer participants in the WIC program, 57,000 of whom would be children under the age of 5. Cuts, that's California. The Head Start program, which again is some of the state dollars have been curtailed for child care programs. Head Start plays an anchor role in a number of low-income communities. We're looking at the potential of 10,000 fewer California children having that place to go to get the help they need so that when they start school, they're ready to learn. $7 million less for refugee assistance. And again, that is a program that has a particular impact in California because we are a gateway state for people who come to this country as refugees. $20 million less for social services block grant. And again, some of those are dollars that historically you have used to help fill in the gaps that have been created through our tough state budget times. So what would we recommend? I think very similar to Mr. Park's comment, we would urge you to contact the California Congressional Delegation. We are very fortunate to have a member of the Supercommittee, Javier Becerra, congressman from Los Angeles, former member of this body, so we do have a direct way to have the interest of California be represented through that process. The Supercommittee should adopt a balanced approach. And by that, we mean significant new revenues in addition to the revenues that would be generated by the sunsetting of some or all of the Bush-era tax cuts. That's current law. Those dollars shouldn't count towards the deficit reduction that the Supercommittee is charged with identifying. The Supercommittee should protect the core low-income entitlement programs. And again, Mr. Park talked about the programs that are appropriately exempt from the across-the-board reductions, but just because those programs are on that list now doesn't mean they're out of the woods. The Supercommittee or Congress as a whole could bring them back in, and I think we are very deeply concerned that TANF, that Medicaid, that foster care, and some of the other very important programs that provide the backbone of our safety net would be subject to reductions as deliberations continue. your staff asked me to address how does this fit with the emphasis on jobs and the need to keep our economy moving forward. And I would conclude by saying that protecting low-income programs and a balanced approach to beginning to address our budget problems is the best jobs program that Congress could develop. All of the economic modeling that we've seen over the past several years consistently shows that the biggest bang for the buck in terms of public investment comes from programs like food stamps, sometimes known as STAP, sometimes known as CalFresh. Also, unemployment insurance benefits. If you want to see a dollar move quickly through local economies, give it to a poor person, because they will take those food stamp dollars, those unemployment insurance dollars, and spend them at a grocery store or a merchant in their local community quickly and keep those dollars moving. And so we would also urge you to tell your colleagues in Congress to delay until we see substantial economic improvement, significant spending cuts. Mr. Park talked about the rising poverty that we saw in the recent census data, more true in California than in the rest of the country. It is critical to keep those dollars flowing to our local communities so that we don't slide back into a deeper downturn. If you look right now at what's happening in the economy right in California, it's the loss of state and local jobs. It's acting like a deadweight anchor on our economy and keeping us from moving ahead. Thank you.
Thank you, Ms. Ross and Mr. Park. I appreciate you coming and sharing your perspective. I'm curious, when I think about the kind of dual impact of if we in the legislature are forced to pull our triggers, and if the Subcommittee deadlocks and therefore sequestration is the only option and the 9% across the board, that feels like the end of the world in terms of the kind of the double, triple whammy effect of cuts in March, if we pull triggers, sequestration. So, I'm hopeful that Congress will be more successful than the legislature was in coming up with a balanced approach, knock on wood. What's going to be their motivation to find compromise? It's really not a rhetorical question. I'm really hoping you have an answer. What will force them to find compromise and come up with the balanced approach that your recommendations suggest are critical?
Well, I think that the two things. One is the automatic cuts are supposed to be the incentive for the members of the Joint Committee to come to an agreement, because they don't want to have sort of the blunt across-the-board approach towards budget cutting. They'd rather have a more targeted approach. That's why also defense spending is half of the budget cuts that are automatically triggered in 2013. So that's part of it. I think the other is that I think that there's a growing understanding that the economic recovery is stalling, and that we are at risk of, at least a very, very slow recovery. Unemployment continuing to be very high. The president has proposed a jobs package that has been getting some traction. So I think there's a hope that the need to do something on the economy, plus the specter of the automatic cuts in 2013, can produce some movement here. Now, I think the important thing to remember is if the Joint Committee doesn't act, Congress can always step in and avoid the automatic cuts at some point thereafter, before January 2013, and the Bush-era tax cuts do expire in terms of the latest extension at the end of 2012. So that also is an incentive for some sort of agreement where there may be some compromise, because among those opposed to revenue increases, certainly they want those expiring tax cuts to be extended. So that could be a bargaining chip or an incentive for compromise there. But I think we are certainly very worried, because the focus on deficit reduction and not paying attention to the economy, as well as focusing on deficit reduction that would go after many of the so-called automatic stabilizers, like unemployment insurance, like food stamps, is counterproductive, and it's going to make the dangers to the economy that much greater.
I would just add one short comment that there is a little bit of separation in time. Again, your triggers affect this year's budget. Presumably, the governor would then, if he decides to pull the trigger in December, would potentially carry those reductions into the upcoming state budget year. But there is, if the economy improves, and we can cross our fingers, although it certainly looks like it will be a slow recovery, the federal cuts would not occur until January of 2013. But again, I think the real risk here is lowering the baseline for those programs and then having the federal cuts come in, taxing the resources of schools through loss of Title I, loss of special education dollars, loss of some of the child care dollars, and the reduction of the baseline for some of the social service programs as well. And we haven't talked a lot about, but since you brought the trigger in, I think another important thing is a lot of the research dollars that flow, particularly through the University of California, would also be affected by these reductions to the extent that the university is able to take an administrative share of cost. Through that would have an impact on particularly the UC system more broadly.
Ms. Yamada.
Yes, thank you, Chair Mitchell. Actually, I have a few questions for both of you, but I wanted to be sure I heard Mr. Park's testimony correctly and then sort of have that comport with what Jean Ross just said. You said earlier in your testimony that there are certain programs that have been set aside and the benefits would not be reduced. And I wanted to be sure. And then I thought I heard Jean say something almost opposite of that it could come back on the table. Oh, so could you, just so that I understand it the best I can right now,
sure. So it's
re-articulate that.
Yeah,
for
sure.
me.
So the automatic cuts, if the Joint Committee don't act, that take effect in January 2013, certain programs are exempt from those automatic cuts. So there's things like low-income programs, Medicaid, SSI, TANF, the Children's Health Insurance Program, refundable credits like the Earned Income Tax Credit, veterans benefits, as well as Social Security are exempt.
Right, the benefits portion.
Yeah.
Yes.
Medicare can be cut by 2%, but not to benefits, only to provider payments and payments to plans. But the Joint Committee is free to consider any cuts to programs, even those that are exempt from the automatic cuts.
Okay.
So whatever it does, or of course Congress itself can always step in outside of the Joint Committee process to make cuts to the Medicaid program, for example. And those were on the table during the negotiations between the President and the Speaker over the debt ceiling, for example,
So
Medicaid savings.
Sequestration.
Okay.
Those programs are protected from sequestration across the board, but not as a part of the Supercommittee's deliberation.
Yeah, the Joint Committee's
Okay, got it.
jurisdiction is over all spending and all revenues.
Yeah, most of the time when we think about sequestration, it's about carbon, but I guess I'm going to call this cash sequestration now. So then to follow on, I mean, I think Mr. Park already clarified for me what Ms. Ross said. So moving on, it just occurred to me listening to the testimony that, the whole issue of putting a cap on appropriations is not unlike, the discussions and debates and conflicts that we've seen in California about having a spending cap put on. And so, the same issues that we are arguing about here in California are being played out. However, it appears that if federal action occurs, or it will occur, it's just whether we agree with it or not, it's going to sort of obviate any state discussions that we've had about spending caps. It's going to be a de facto spending cap that we will have to labor under. Would that be correct?
Yes, because states do receive a significant amount of federal funding, both in mandatory programs like Medicaid, but also in discretionary appropriations. And I think it's also important that in the broader federal deficit reduction debate outside of this Joint Committee process, there have been proposals put forward related to a federal balanced budget amendment, which the Budget Control Act requires Congress to vote on, but also what's called a global spending cap, basically setting federal spending as a percentage of the economy. but those caps are usually set at a level that either at or below the historical average, and certainly ignores the long trend demographic trends that we're going to be facing, namely the aging of the population.
Yes, thank you. I was just going to bring that up, but absolutely
and that
flies in the face of the demographics.
Yes, and that would be obviously an even more draconian cost shift to states and to individuals.
Okay, thank you.
I'd like to add one thing, which is this is precisely one of the reasons why we have historically urged you to reject a spending cap or measures that would function like a spending cap in California, because if cuts of this magnitude do occur and there is a tight spending cap in place in California, you will have your hands constitutionally tied when it comes time to figure out how are you going to backfill the hole in special education, how are you going to backfill the hole in child welfare services, how you are going to backfill the hole in transportation spending, and some of the other programs outside of this subcommittee's jurisdiction. And I think, again, you can't, there are many factors that influence the state budget that are out of your control, and this is an excellent example of why spending caps just don't work in a changing world.
One last question. I believe we all know that California is a donor state, and I think there was just another report that confirmed that maybe 2 or 3 days ago. Do you see that, in any of this sort of one-size-fits-all approach that the Committee of 12 is grappling with, is going to take into consideration the differences in the amount of revenue that is sent to Washington versus what's going to come back in the form of cuts that I think we will be seeing? Has there been any discussion of that?
There usually is, in terms of both the broader discussion of deficit reduction as well as how specific proposals could usually affect members of Congress's home states. But unfortunately, it seems over the last year or 2 years that the focus on deficit reduction has sort of moved away from that traditional view. So I think that, for example, in the House-passed budget plan, which block granted the Medicaid program, many of the states from some of the proponents of the block grant are the ones who were disproportionately affected by the block grant. But unlike in previous years, being able to demonstrate that didn't have the same impact. So I think that there is sort of a different tone. I would say I don't want to generalize too much, but I do feel like that used to be a common sort of frame to view things, but now everything's being viewed at the 30,000-foot level, and I think that's unfortunate.
Not good for us.
We better send Congressman Becerra a Superman cape so he can represent and a box of Wheaties. Before we move on to our next panel, we spent a lot of time talking about the impact of the cuts. But as you suggested, a balanced approach would be the preferred outcome of the Supercommittee's work. What are some of the federal revenue concepts or ideas, the revenue increasing ideas that have been mentioned or that they could possibly even consider?
So some of the revenues are corporate tax loophole closings, some subsidies for various mineral and gas producers, but the large share or source of potential revenues is in the area of so-called tax expenditures. This is the whole range of deductions and exemptions and credits that are in the tax code that primarily favor higher income households. And can some of those be curbed to produce significant revenue increases? Because while a lot of these deductions and other tax preferences are done to incentivize people to do certain things, including home ownership and things like that, that the disproportionate share of the benefits of these tax expenditures go to very high-income taxpayers. So can they be curbed? The administration for several years now, for example, has set a limit on how much high-income tax households can benefit from these various tax expenditures. So that's one way you can get significant revenues. And on a bipartisan basis among both conservative economists and more progressive economists, they agree that tax expenditures is one way to go. So we hope that would be something to look at. And of course, as Ms. Ross pointed out, this is also on top of the tax cuts expiring, which in and of themselves can really improve the long-term federal fiscal outlook in coming decades.
I'd add allowing a robust estate tax to come back when those tax cuts expire. Some of the preferences for oil and gas exploration that we've heard about, and some of the tax expenditure programs that Mr. Park talked about, limiting them or eliminating those programs at the federal level would also provide opportunities to close the same tax loopholes here at the state level, which would give you some resources to help address the state's budget problems as well. So there could be sort of a two-for benefit from some of those efforts at the federal level.
Any other questions? Would like to thank you both for your participation. Mr. Park, you keep your seat because you're going to participate in the second panel. Thank you very much, Ms. Ross. We're going to have the addition of the second panel come join us. The sergeants are going to need to add some additional chairs, if you will. Don't worry about the order, because I'm going to ask that Finance and LAO present first. Age before beauty. And I'm just suggesting that we go in that order, have LAO and Finance present first, just because they can, I think, can provide additional kind of broad-based perspective and response to the first panel. Mr. Wright, we have plenty of chairs. We won't have you go on your knee. Thank you very much. Let's get started with the LAO. I want to thank the LAO for the paper that was developed, an overview of federal funding in California. I found it very helpful to, succinctly in one place, really understand the magnitude of these potential cuts. And when you recognize the percent of our overall state budget and general fund that is funded by and influenced by federal funding, it just makes this conversation all the more critical. So if we'll get started with the LAO.
Thank you, Chairman Mitchell. Todd Bland with the Analyst's Office. As of starting next month, I will be the Deputy Legislative Analyst for Health Human Services.
Congratulations. We'll be seeing a lot of you then.
Thank you. As you mentioned in a conversation with your staff last week in preparing for this hearing, we did prepare a handout overviewing federal funds. I believe you already have that. There's a few right here, and I believe I left some back there for the sergeant, and I believe it's on our website as well. I'll just, the words I'll share will not be exactly what's in the handout, but I will move along with the handout. To start out with, I'll just give you sort of one very, very big number, $330 billion. That is total federal funding in one way or another passing through California. That is from the Census Bureau's report that they just issued this week. I believe it's for federal 2010.
And that's across all programs or just health and human services?
No, that's everything. That's every federal dollar flowing into California. And it's very broad. We're going to sort of get to the, so the way I've sort of divided, so taking that big number, 330, let's break that into sort of two big pieces. First, 80 billion, 79, but we'll call it 80 for round numbers, that does run through the state budget. So 80 is kind of inside the state budget, not necessarily directly appropriated in the state budget. There could be continuous appropriations. Some of these things are various matching streams, but sort of 80 roughly inside the state budget, and then 250, a much bigger chunk, sort of outside the state budget. So with that in mind, let's work through the handout a little bit.
And so, outside the state budget would mean just directly funding programs.
We'll get to it. It could mean something like Social Security. It could mean something that flows directly to an individual. It could be a defense contract. We'll get to that sort of towards the end. We're sort of starting with kind of what is in your state budget, and then we'll kind of, first we're going to drill down essentially on the smaller piece, which is the inside the state budget. Then we'll talk a little bit about the bigger piece that's outside. So on the first page, if you turn into the handout, essentially we're kind of mixing purposes here. First, we're showing you sort of the four broad fund types kind of within the state budget of general fund, federal funds, special funds, and bond funds. And we show you the numbers for the last 3 years, including what was in the 11-12 budget. And essentially, in the third number column, federal funds, that's 79,182. That's the 80 I was just speaking of. And as you can see, that $80 billion, in terms of the 11-12 budget, it represents 38% of the funds when you count general fund, special fund, and selected bond. It isn't often displayed in this way, but essentially that's what you've got, with the general fund being a little bigger at 41%, special funds at about 16%. In looking across the table at how the numbers are moving, you see the decline from over $91 billion down to about 79. A lot of that, we believe, is the phase out of the Recovery Act funds. On some level, you're seeing an increase in the special funds. That's probably a little bit of the realignment dollars showing up as special fund. As I said, not all of the funds necessarily federal here are appropriated within the state budget. And as I'm going to talk about on the next page, there's also some somewhat strange accounting that goes on in all of this. So turning the page to the, we'll get to, just the way things are labeled. No, nothing nefarious, just as we'll discuss. Sort of drilling down, the next page, we're trying to take you through, again, back to your initial question, which is how much of that was Health and Human Services versus that. So here's the $79 billion again. This time we're showing it to you by agency. And the biggest chunk is the $41 billion in the Health and Human Services, or 52% of the federal funds. What I meant by the accounting is interesting. In the labor and workforce development, a lot of that $19.7 billion is virtually, almost all of it, in fact, is with the Employment Development Department, and most of it's for unemployment insurance. What's somewhat odd is the state contributions, essentially the contributions under your policies as the legislature setting the tax rates and the system by which the unemployment insurance system is funded. About $5 billion is flowing into that from California employers. That actually passes back through to the federal government and then back to us. So even though that $5 billion, I would think of that as sort of state money, it's actually showing up in the federal column.
Okay.
And since that just happens to be a program I know something about, I'm guessing there's other accounting anomalies. So anyway, but again, thinking big, $330 billion, 80 running through the state budget. And that is the second biggest amount, is the labor and workforce. And again, a lot of that is unemployment insurance. Education, I think some of the early witnesses were mentioning Title I and some of those kinds of titles. Business, transportation, housing. We were somewhat surprised that that number came in low. We thought transportation might be bigger. Turns out we think a lot of that flows directly to the locals, not through the state budget. Turning to the next page, trying to drill down a little bit further. This is now, instead of looking at the $80 billion, now we're just looking at the $41 billion within the Health and Human Services area. By far the largest chunk of the money, 71%, is in the Department of Health Care Services, at least the way it's shown budgetarily. Most of that is Medicaid, the federal funding stream for our Medi-Cal program, but not all of the expenditures are occurring in the Department of Health Care Services and in the traditional Medicaid program. The In-Home Supportive Services program and other programs also draw Medicaid. So you see the whole $29 billion showing there, but in fact it's sprinkling across other programs as well. But this is the way it is accounted for in finances worksheets. Social services, the Department of Social Services has the next biggest amount of money, almost $7 billion, and that's split across child welfare, the CalWORKS program, the federal TANF program at the federal level, and this is the administration of the food stamps dollars, now called Supplemental Nutrition Assistance Program, or CalFresh in California. But it's just the administration. Okay. So now we'll turn to the last page, which is sort of the bigger chunk of funding. And yes, we spent 3 pages on that. That was the stuff that the LAO knew more about. We had more data available. This other stuff, the sort of the $250 billion that's outside the state budget, we know a lot less about that. We can see big numbers in the Census Bureau's reports, but it's not something we know have as many details about. As I said, these are expenditures of everything from payments to individuals like Social Security. It would include Medicare. It would include defense contracts, any type of procurement contract the federal government, and the salaries and wages of the federal workforce residing in California. I believe it would also include things like Section 8. There's just many, many different things here, almost sort of too hard to categorize. But I think the main message we want to leave you with is it's a lot bigger than the $80 billion that's flowing through. And I know that I think some of the earlier witnesses mentioned Head Start. That would also be largely outside. The final programs we highlighted at the bottom, again, Social Security, Medicare, Supplemental Security Income, and the Nutrition Assistance Program, we highlighted those because they are big, major federal streams that to the extent they are changed, they will affect and impact the safety net that you're more in charge of here in California. And to that list, if I were redoing it, I might add Section 8 housing. That's a quick overview that your staff asked for. Hope it was helpful.
Good afternoon. Kristen Shelton, Department of Finance. As has been outlined previously by other panel members, the impact to California, while we're taking a lot of good guesses of where it may have impacts, are largely unknown and certainly will remain that way until formal recommendations come forward from the Supercommittee. Unfortunately, because of the timing of those developments, we are going to have a very limited amount of time to react to those proposals, and they come very late in this calendar year, which will severely limit our ability to recognize or acknowledge that as we proceed with our budget development process. Finance staff are very closely throughout our organization monitoring the information, trying to stay abreast of that data as it becomes available and assessing what potential impacts are as different options and alternatives are floated. We continue to work very closely with our governor's office, D.C. office, as well as the California Congressional Delegation, our National Association of State Budget Officers, and the National Governors Association, making sure that through those partners that we have a strong voice for California and can weigh in on any proposals as they come forward.
So just kind of a process question. I appreciate timing could not be worse for your process. So are you saying that basically the January 10th budget won't reflect anything in terms of the work of the Supercommittee,
right,
if they indeed
right,
have a product that Congress votes on?
So if the Supercommittee does not take a vote prior to that November 23rd deadline that's been highlighted, we really will be unable to include anything in the January 2012 governor's budget proposal. What would more likely happen is that we would be reflecting any changes in law, federal law, that get enacted as part of our 2012 May revision, which really limits.
Right. Thank you very much. Appreciate LAO and Finance. This screen only shows half of the folks who will be participating on this second panel, but why don't we go ahead and follow the order that's listed there. So, Mr. Park, if you would. Oh, sorry about that. Okay, that's fine. Ms. Yamada asked that you don't go far.
Yeah, don't go away.
Okay, great.
Thanks again for having me testify about some of the individual health care proposals that might be considered by the Joint Committee. So I'll go through 3 proposals, 2 in Medicaid and 1 in Medicare. So as I mentioned earlier, the Joint Committee can consider anything, including proposals that are exempt. So there are 2 proposals that are likely to be considered on the Medicaid side. That would they share a common theme. They shift significant costs to states and, of course, then on to individuals and their families and to the healthcare providers that serve them. So the first one is called the blended rate. So what's the blended rate? As part of its April deficit reduction framework, and again, a couple weeks ago in its recommendations to the Joint Committee, the Obama administration proposed starting in 2017 to create a single matching rate to replace the various matching rates at which the federal government reimburses states' costs for Medicaid and the Children's Health Insurance Program. Currently, states have a regular Medicaid matching rate, which is 50% in California. Federal government picks up 50% of the cost. A CHIP matching rate, California 65%. And then the new matching rate for those made newly eligible under the health reform law's Medicaid expansion, which is 100% for the first 3 years, 2014 through 2016, and no less than 90% on a permanent basis after that. So you can have a single rate based on that. Now, while details are still forthcoming from the administration, the blended rate would effectively be some sort of weighted average of these matching rates. But whatever that weighted average is, that weighted average will be set at a level below what would be provided under current law to produce federal savings. So basically, if the blended rate is 60% in California, the state's going to get something less than 60% to actually produce federal savings. Otherwise, it's budget neutral, doesn't produce any federal dollars. Now, that saves the federal government money, but of course, the state has to come up with a way to pay for those reduction in federal funds. According to the Obama administration, this proposal would save $14.9 billion over the next 10 years. The important thing to note is earlier versions, including ones from the framework and what was reportedly being discussed between the president and the speaker, the savings would have been much larger, 50 billion, 60, 75, even more billion over 10 years. So states are going to have to either contribute more. California is going to have to come up with more money for its Medi-Cal program, or it's going to have to cut back services under Medi-Cal and CHIP or cut provider payments. So that, again, is on top of the cuts that the state has already had to make for its own budget shortfalls it's been facing. Now, the other Medicaid proposal I want to mention is a proposal to limit or eliminate the use of provider taxes. You're probably very familiar with the use of provider taxes in this subcommittee. Currently, nearly every state in the District of Columbia and, of course, California use these taxes on healthcare providers, physicians, hospitals, nursing homes, managed care plans to help finance their share of the cost of their Medicaid program. Now, the Obama administration has proposed to go beyond current law and restrict the ability of states to use these provider taxes. Other proposals go farther, get rid of them entirely. The administration estimates that its restriction of the use of provider taxes is going to save a little over $26 billion over the next 10 years. Now, limiting or going farther and taking away entirely the ability of states to use provider taxes represents another cost shift. It produces federal savings on the assumption that states like California can't come up with other revenue sources to replace provider taxes, so they have to cut their Medicaid programs because the federal government picks up half the cost of the state's Medicaid program. That means federal costs go down and the federal government gets savings. Of course, the actual impact on beneficiaries and providers will be much greater. For a state like California with a 50% matching rate, to achieve $1 of federal savings, total Medicaid expenditures in the state have to fall by $2. It's the same as when the state cuts its share of Medicaid costs. So that means, in actuality, we're talking at least $52 billion in total Medicaid cuts across the country. And, of course, it would be much larger than that if provider taxes were eliminated entirely as an option for states. So the last proposal I'll quickly touch on is a Medicare proposal, which I mentioned in my earlier testimony, and that's about raising the Medicare eligibility age. So right now, you're eligible for Medicare when you turn 65, or if you qualify because you have a disability for SSDI. Now, one proposal that was seriously considered during negotiations between the President and the Speaker was a proposal to raise the eligibility age from 65 to 67. Now, this proposal only saves the federal government money because you're effectively shifting the costs onto seniors as well as states and employers offering retiree coverage. Now, why is it a shift? Well, many of the seniors, because Medicare won't be available to them as a 65 or 66-year-old, they're going to have to buy private insurance instead. So they're probably going to buy coverage to the new health insurance exchanges set up under the Affordable Care Act. Some of them are going to get subsidies. Some of them aren't. But it's likely to be more costly than Medicare because private insurance, for a number of reasons, is more costly than Medicare coverage. So that means, on average, according to a Kaiser Family Foundation study, 2/3 of seniors are going to face higher out-of-pocket costs, higher premiums and cost sharing, an average of about $2,200 a year more. So certainly some of these seniors are going to end up uninsured because they can't afford these higher out-of-pocket costs. Now, states would see higher costs as well because some beneficiaries would now have to get all their coverage through Medicaid. So right now, instead of Medicaid being supplemental to Medicare for the dual eligibles, Medicaid's going to be primary. So instead of having to just pick up costs like long-term care, nursing home coverage that Medicare doesn't cover, you have to pick up under Medi-Cal, physician care, hospital care, other services. In addition, it's not, excuse me, well known, but the new exchanges are also likely to have higher average premiums as a result because you're adding 65 and 66-year-olds to that health insurance risk pool. And older individuals tend to be somewhat less healthy than those who are younger, so that would drive up the costs of the exchange, particularly in its early years. Now, the increased cost to beneficiaries, states, and employers under the increase in the eligibility age actually is twice as large as the net federal savings. So in other words, the proposal actually increases overall costs. It doesn't constrain costs, it shifts costs and actually makes costs overall greater. So according to the Kaiser study, if the proposal was fully effective in 2014, in that year, in 1 year, the savings would be $5.7 billion for the federal government, but the cost to everyone else in higher costs, like states, individuals and employers, is $11.4 billion. So twice as much. So I'll conclude there, but all of these proposals have common themes: cost shifts to states in terms of their Medicaid program, and certainly onto individuals and their families. And as I mentioned, the goal is should be to constrain costs, not to shift them.
Thank you very much, Mr. Park. I'm sorry I neglected at the onset of the second panel to share with the audience kind of the overall focus of the second panel's presentation and what they were really asked to address. Again, this is a compilation of subject matter experts in health and human services programs, and they'll present an analysis of potential impacts on Californians, health and human services programs, potential cost shifts to state and local government, as well as their recommendations around key principles that the Supercommittee should consider as they develop the proposals. So I apologize for that. Thank you very much, Mr. Park, for sharing with us the health perspective. We'll go on to Vanessa Kahina from the Western Center on Law and Poverty.
Madam Chair and Assemblywoman Yamada, Vanessa Kahina with the Western Center on Law and Poverty. I really couldn't do a lot better than Mr. Park has done in terms of laying out the numbers federally and at the state level, and also what Ms. Ross has provided to us in terms of what the impacts look like in an overall way. What I'm really here to do today is to talk about principles, some very recent California history, and how we move forward. The Western Center would highly urge, if we're having a conversation today with the Supercommittee, we would urge them to adopt a poverty principle and to walk away and not touch anything that would either put people into or dig people deeper into poverty. Mm-hmm. We are living in a new normal in California, and I have said repeatedly over the past 5 or 6 years, I don't know what it's going to look like when we're out of a deficit situation, and I think D.C. has finally caught up to where we are at the state level. In the recent past in California, we've done things that we thought were unthinkable at one point. We have cut $3 billion out of our own Medi-Cal program in the past 3 years. We have people who don't have teeth in their mouth because they had their adult dental care taken away. We have cases from throughout the state about just high health needs who aren't having their needs met at this point. This year, we did other things that we thought were unthinkable. We put visit utilization caps on people in Medi-Cal. We are asking pregnant women to pay $50 if they go to the emergency room to give birth, and then to maybe charge the infant $50 as soon as they're born for being born. We put kids onto a wait list in Healthy Families in 2008 as a direct result of our budget deficit and Mr. Mibb not being able to fund its responsibility to children. We were at nearly 1 million kids enrolled in Healthy Families in 2008. We're not at 900,000 now. We might be a little over that. But these are the kinds of things that we can't recoup. There are 100,000 children who had insurance who no longer have insurance. These are decisions that we made at the state level. California gets our FMAP at a lower rate than a lot of other states. We're at a dollar per dollar match with the feds. And I think that there's a lot of fear within our community that since the stimulus increase went away within our own FMAP, that we're going to see a lot of other bad changes happen. And, you know, from where we've been last year, I don't know where we go next year. This is a scary time. We've done significant grant reductions to kids in CalWORKs. You know, fortunately, we've been able to make it by with food stamps, and I think that some of the worst proposals that we've been faced with, we've been able to get away from, but still, this is not a good time to be a low-income person in California. People who weren't low-income are now low-income and are seeing the effects of this. You know, I've been told by county welfare directors that the welfare office looks different now, with different kinds of people who are now unemployed, who are applying for the benefits that they maybe used to help people with. So I think, the bright spots have been is that we've hobbled through this with some increases in the federal match rate with ARA funding. We've actually had a good group of stakeholders who came together to provide the provider tax in Medi-Cal and Healthy Families that literally saved the program. So hats off to our provider community for doing that. When we start to talk about threats, I think the Supercommittee really does have carte blanche in terms of what they can propose and what they can cut, and if that's agreed to, then we're done with it. I think politically this is a very tenuous time for health reform to be happening, and that the matches that California was supposed to get in terms of increasing the people in our Medi-Cal program, which by and large are the largest number of uninsured people who would be qualified for that program, those could very easily go away. This is not an easy time in terms of looking at the court cases in front of us, going to the Supreme Court on the individual mandate issue. It's tenuous. We have our work cut out for us. There's been talk about block granting, the SNAP program, which in California is CalFresh or food stamps for those of us who aren't aware of it, in terms of letting a state be able to decide in a block grant mechanism, which is what another proposal in terms of Medicaid has been at the federal level. It's not good stuff for our community. Even the president, as Mr. Park has indicated, has proposed blending our Medi-Cal rates with CHIP, and I think the thing that's most unnerving from Western Center's perspective is the elimination or extreme degradation of the provider tax, which is agreed upon and is a self-imposed tax. So generally, Medicaid is protected through the sequestration process, but what we can do either at the Supercommittee level or even if something goes haywire within sequestration is the fear of the unknown. So I think to sum up, we can't make cuts that are going to drive people further into poverty. 1 in 4 children in California are living in poverty. Most of them are children of color. This is becoming a huge, huge inequality issue within our state. So with that, we would make the plea to you as being people who might carry some water in Washington, and particularly with our member on the Supercommittee, to work with them to really push home the impacts of this, about what this means federally and what this means for the future of the state and for the country. Thank you.
Thank you. This whole concept, Ms. Yamada, of the deep poverty, Mr. Park raised it, Western Center raised it as well. I mean, that's not something I think in the legislative arena we talk about enough, and just recognizing that we're creating yet an additional class. Sweet Alice, the founder of Mothers of Watts in South LA, refers to this community as the poor, the folks who, are at greatest need and rely heavily across the aspect of their lives on safety net programs, and really being clear about the situation that we're creating when we're creating a subdivision of poor people. Is really, I think, frightening.
If I can just jump in, sometimes I think of it as we used to discuss our society as the haves and the have-nots, but I look at it now as the haves and the never-wills, because we are, in our country and our state, making, ill-advised policy decisions or decisions forced upon us because of the inability to reach an honest discussion or honest recognition of what it takes to survive in, just in a bare subsistence lifestyle. We are actually contributing to a permanent underclass and an expanding permanent underclass.
It's true.
So we'll keep pressing forward, though.
Thank you, Ms. Kahina. I appreciate that. Moving on to Anthony Wright, Executive Director of Health Access.
Thank you to both the distinguished chairwoman as well as to my assemblywoman, Ms. Yamada.
To behave myself.
Please don't. Before I go into my testimony, which I did provide to the committee, I think it's part of the challenge of addressing the issue of how to analyze these cuts is to even just keep track of them, is that there's, I think, a couple of different categories. Number one is there's the bucket of cuts that were made as a result of the standoff with regard to the raising of the debt ceiling. Number two, there are the cuts that are in the sequestration, that would be triggered if no decision is made by the subcommittee. And then there's a sort of wide range of potential cuts of what the supercommittee or some future combination of congressional activity would do. And there's a wide range, and that includes everything from what the House GOP, for example, has passed in the Paul Ryan budget and in other contexts, and there's a range of potential cuts there. There's what President Obama has proposed just earlier this month in his package, and then there is a lot of things that people have known have been on the table in one way, shape, or form, but we don't. But in some cases, these are public, like from the Bowell-Simpson Commission, or in some other sort of Washington think tanky kind of processes, and others that have been in private, and so we don't really know what the specifics of those proposals were. So it's very hard to say, well, what's the impact of this? You look at these 5 buckets, and you can talk with some certainty about the cuts made and the cuts in the trigger, but with everything else, it's an open question. But that said, we do think that there are some fundamental, and in my testimony, I lay out some sort of decision points that we need to make, and that California can advocate in one voice on, because it has an impact on California as a whole, as well as particularly on health and human services. First of all is the question of short-term versus long-term. Given the current economic situation, especially with California with a 12% unemployment rate, this is not the time to implement significant cuts that would harm our economic recovery. We agree with the chairwoman on this. We should speak with one voice that, frankly, at this moment, we need additional assistance, even if it means revisiting some of the assistance that has just recently expired just in July, whether to the state, the enhanced Medicaid match that we lost, or directly to families, the COBRA subsidies that had been in place because of the ARA package that simply went away in July, and those are lost funds to the state of California and our families. We don't disagree that there is a need for long-term deficit reduction. In fact, we, as health advocates, have as much at stake as anybody of having Medicaid and Medicare be sustainable into the long term. But an important part of that is to get out of the current historic economic crisis that we've faced. As Mr. Park mentioned, we did have part of the reason that we're in this hole is because of past decisions that can be revisited. Perhaps the 2 wars are something that we can't revisit, but the 2 package of tax cuts can be. Another decision that was made was the passage of the Medicare prescription drug program, and I don't think we should visit the whole thing, but we should certainly look at, for example, the issue of how much prescription drug companies are getting out of that package. One of the things that President Obama has proposed is to align the Medicare payment prices and rebates with what they get under Medicaid, which would be a significant savings, and align two federal programs together. But I think that when you look at the long-term protections, the issue is not with there's been a lot of focus on these discretionary programs, but the problem really isn't with these discretionary programs, including with human services or with public health. It's with this fundamental issue of health programs and health care. That if you actually let the various tax cuts expire and other issues of current law, then the real trend lines going up in 10 years and 20 years and 30 years, it's all about Medicare and Medicaid, and it's all regarding about healthcare costs. Now, let me be clear about this. This is not a Medicaid problem. This is not a Medicare problem. This is a healthcare problem. That this is the fact that healthcare costs are going up. The base healthcare costs, the underlying healthcare costs are going up at an unsustainable rate, and Medicare and Medicaid are simply reflecting that. In fact, these programs actually do a better job than the private sector in providing less expensive care, often to a more vulnerable, more sick population. But the problem is that if the overall healthcare costs are going up, then that's going to be reflected in Medicaid and Medicare, and that's what creates the real deficit problem in the long term. So how do we deal with that? Well, we don't believe the solution is to undermine or attack Medicare or Medicaid or radically restructure it, as some of the proposals in D.C. are. We think this is a solution. Nor do we think the solution is to simply shift the burden of the rising cost of health care from the federal government onto seniors or onto the states. We think that we have to find legitimate savings in the healthcare system. And so I do want to talk a little bit about this cost shift, although Mr. Park and others have, I think, fully spelled out some of the issues. I mean, if you have a proposal to radically restructure Medicare into a voucher program, the CBO and other by all accounts, the savings that comes from that program is that the value of the voucher is not going to keep up with the cost of medical inflation. That's where the savings comes from. So that will be to begin with, that's a cost of hundreds, if not thousands of dollars to seniors, but that goes up over time. The same with the proposal to block grant Medicaid. It would cap the amount of dollars that Medicaid that states get. And that means that if there is a recession and enrollment goes up in Medicaid, if there's a public health emergency and costs go up, California and other states would be stuck with the bill of those, of these big ticket items. So we think that shifting additional costs to states, that's just simply forcing the states to do the dirty work of cutting eligibility, benefits, and provider rates, with the resulting consequences on families, on our health providers, and on the health system that we all rely. So California, we think, should speak with one voice against any deficit proposals that simply shift the cost of health care onto states, onto seniors, or onto low-income families. This simply makes patients and taxpayers pay more in the end. So this doesn't mean that there isn't savings to be had to find the ways to control and reduce the cost of care. And in this regard, I do want to acknowledge something, which is that it's important to recognize that the federal government has already passed the most sweeping deficit reduction package in a generation. It's called the Affordable Care Act. It included a range of provisions to reduce the rising cost of care. It was paid for with a combination of revenue and savings. But even on top of the expenditures it has, it will provide over $210 billion of budget savings over the next 10 years and over $1 trillion over the next 10 years. Some of those money-saving measures were booked, but others were not, because there's things like prevention, like information technology, like other things that, in fact, it's just no way to quantify what kind of savings we provide. So we hope that some of those actually do provide savings into the long term. We like to think of it that what it does is it doesn't do everything that we can do, although it does a lot with regard to the cost of health care, but it provides the tools it provides some new tools, some new platforms to continue this important work of trying to reduce the base cost of health care to begin with. That's at the end of the day, the real issue with regard to this. So that's what we want to really focus on. But let's recognize that we passed the Affordable Care Act. Let's recognize that just earlier this year we passed $1 trillion in discretionary spending. And so then the question is, how do we balance the cuts and savings that we've already done with revenues, with letting tax cuts expire, closing corporate loopholes, and calling for shared sacrifice, not just from those who depend on Medicaid and Medicare, for example. And so with regard to the cuts the cuts in the trigger and not, I would just again say that I think that has been, Mr. Park has talked a lot about that. I would sort of say that just to give a scale of sort of the concern about the blended rate, for example, the blended rate is not actually, from a policy point of view, a blended rate is actually not a bad idea in a vacuum. If it actually provided the same level of resources or even more resources, it would actually be a good thing. It would be simpler. But even in the president's proposal, stated proposal, rather than what was rumored to be discussed in closed doors, it projects a savings of about $15 billion to the federal budget. Now, if we don't know what that formula would look like, maybe that formula would benefit California, given the composition of the Senate. We don't know that it would shift in our direction. But if it just was proportional to us in our representation, then we would get about 12% of that cut. That would be an order of magnitude. That would be larger than, for example, the size of the cut to eliminate dental and all the other 10 benefits that we had to do in 2009. So that's sort of the order of magnitude we're cut, even with just the president's proposal, much less what else would come out of that. So that gives you an example of the scale of what we're talking about, much less when Edwin talks about proposals that are bigger in size than sort of $16 billion over 10 years. So fundamentally, just to close, California needs to watch this process very carefully, but we should send a strong message that we want a deficit solution that doesn't add to other problems. So we shouldn't have a solution, a so-called solution that adds to our jobs crisis. We shouldn't have a solution that adds to our poverty crisis. We shouldn't have a solution that adds to the problem of healthcare costs to patients. We should have a solution that actually addresses some real issues in our healthcare system, as well as in our budget crisis at the state and federal level. Thank you.
Thank you, Mr. Wright. I'll remember that. We shouldn't have a solution that creates a problem.
For a change.
That's right. Profound. Thank you very much. Mr. Passmore, Director, Congress of California Seniors.
Thank you, Chairman Mitchell, and our hero, Marika Yamada, for sitting through this hearing and giving us the opportunity to be heard on this big issue. I'm going to turn all of my planned testimony around completely and go to the conclusions. And then I want to make a few statements about the big issues of Medicare and Social Security that seniors rely on. It's the very heart of our survival, but they don't come through your subcommittee. First, let's talk about where we're headed. And the fear that many of the seniors that I work with have, frankly, is that we're headed into intergenerational warfare with my friend here at 100% Campaign and Children Now. And it's a serious issue.
Yes, it is.
At the end of the day, there are going to be two very vocal and very worthy groups standing in the room fighting for what's left on the table. And it's a world I don't want to live in. And we've got to find a way to balance those interests and recognize that most families have both concerns, and to create a society in which we're investing but also rewarding. The second thing I want to say is, if we follow the course that's been outlined or described here, we're going to find ourselves back to the future 75 years ago, when more than half of the seniors in our country lived in poverty. And not just marginal poverty. Every county had a rest home. It had places that where people who could not feed themselves went to live. And a disproportionate number of those people were old. In 1935, when Social Security was created, 5% of seniors lived on pensions. Could you believe that? And only 15% of them had access and hope for any kind of pension. We're headed back there. And if we're not careful, we're going to destroy the goose that laid the golden egg, which is Social Security, which stabilized poverty or the lack of poverty for the 4.5 million seniors today, but more importantly, for the 10 million seniors in about 2040. It's a great challenge, I think, demographically, as Assemblymember Yamada said, but morally, of what this state faces. What will we do if we have 5 or 6 million destitute older people who cannot take care of themselves, afford decent housing, eat, or get health care? And right now, that is the road down which we are going, if we don't fight back or speak out or try to be fair. And that's the next thing that I want to say, and it kind of goes to Anthony's point. Health care is a house of cards financially. And if you pull out one of those cards, like dramatically cutting provider fees or access to Medicare, those costs don't necessarily disappear. Instead, you have fights over rate regulation in the private insurance market. We can't create a Medicare system that treats providers like our Medi-Cal system does. And if we cut Medicare dramatically, this state probably can't continue subsidizing health care with an underfunded Medi-Cal program. That's what I mean by a house of cards. It's very fragile today. The fourth big point that I wanted to end up with is that the seniors that I work with truly want to restore a sense of fairness. We are troubled, and some of us are outraged that we see one sector of society bearing the brunt of all the cuts, as Vanessa Kahina said, and we see another sector of society which is benefiting from all sorts of tax freezes, cuts, credits, or whatever. And it hasn't gone unnoticed to us that there are a lot of white and gray heads in those pictures of the Tea Party rallies. So we've got an enormous job to do to educate seniors about our community, about trying to get along, if you will, about trying to live together and share. So those are the kind of philosophical things I wanted to end with. I want to address a couple of your specific questions. Number one, what can we do to create economic recovery, create jobs, and so on? Quit cutting public sector jobs. You guys have been really good at that, whether you admit it or not. Every IHSS care worker is a fairly good job, and the person that has it needs it. We can't continue to whack money out of money that's going to local governments so that they're forced to get rid of public safety people and teachers and school support personnel. Not every job is in a cute small business down the street. And the public sector is hurting right now, and we are losing tens, maybe hundreds of thousands of public sector jobs that are critical to keep our economy afloat. The next thing I would say is that you and we need to fight back in our messaging. I'm really tired of hearing that if we cut taxes and cut deficits, we can, quote, grow the economy and create jobs. The evidence is completely the opposite. We do not, in this kind of economy, create jobs and grow the economy by cutting government spending. It's probably all that's keeping us afloat, especially at the federal level. Now let me go back and just add a couple of seconds or minutes. Social Security and Medicare are the two centerpiece programs. You don't see them, but you know that if they are significantly cut, you're going to see the consequences. 5.5 million people live on Social Security in California. $1,100 is the average monthly Social Security payment. Nobody's getting rich living on Social Security. And we strongly oppose things that will change the cost of living, will further increase the age of eligibility. We believe Social Security has nothing to do with the deficit. It hasn't created a dime of the debt. It can't. And we believe the solution to Social Security can, over time, be fixed with changes in revenues the same way Ronald Reagan fixed it. Okay? Medicare's a very different story. It's dicey financially. It has lots of challenges. But for all the various reasons I said, we've got to proceed very carefully, because tinkering with Medicare will pop up creating a problem for Medi-Cal. It will pop up in creating health insurance costs in the private sector. So generally speaking, my organization is favorably disposed toward President Obama's recent proposals. And as Anthony said, forcing the drug companies to get less for the drugs that they offer, making common sense changes in the post-acute care costs of taking care of people and trying to keep them from ending up in a hospital again. But we've got to proceed carefully and quickly on changes to Medicare. With that, I'm going to close, but I will tell you, because of the demographic dynamic, we are a big part of the problem, and we acknowledge that. And we're trying to do our part to be a big part of the solution. I met this morning with Congresswoman Doris Matsui and talked about these same issues and the resolutions that you have before you. Our state president has just left a meeting with Javier Becerra, a 2-hour meeting today in Los Angeles, to talk about the needs and concerns of seniors. And as Californians, we've got to get together and fight back. Otherwise, the consequences are going to look like the issues that I described. Thanks.
Mr. Passmore, thank you very much. One point you raised is echoed by United Domestic Workers who submitted their written testimony and shared with us a study on potential job loss in California if the federal Medicaid and Medi-Cal programs are cut. And they quote a study published in June of this year by Families USA that estimates that even a moderate 5% cut to the federal Medicaid program will result in the loss of over 28,000 jobs and $3.7 billion in lost business activity. So I just wanted to share that because it
and
really
I know you're
point.
struggling with the action that was taken here of eliminating 7,000 jobs to serve the 35,000 people who were in adult day health care.
Precisely. Thank you very much. We'll move on to Deborah Doctor, the legislative advocate for the disability rights of California.
Good afternoon. I'm going to have to turn around a little bit here. Thank you for letting us testify today. I guess I'm going to have to fight with Gary and Nisette. We'll be the third group battling.
No fighting in the Just Sunroom hearing room.
But we all overlap, actually.
Yes. That's right.
There are people with disabilities who are seniors. There are people with disabilities who are children. My organization represents people with disabilities of all ages. People with disabilities of working age have a 70 to 75% unemployment rate. 70 to 75%, not 12% or 14%, 75%. That is an unfortunate historical truth. People with disabilities who need any kind of assistance with daily living have a family income that's half of the family income of other Californians. Several years ago, when we were talking about state budget cuts, our board of directors adopted the following principle. Balancing the budget must entail a combination of revenue increases and expenditure reductions that do not unfairly target the low-income end of the economic spectrum. So we are in line with all the other speakers here. We often hear people in casual conversation or in the press refer to somebody with a disability as, she suffers from the disability of whatever. But I think it's fair to say that people with disabilities are suffering more from the budget cuts that have happened, the program cuts that have happened in the last several years than they do from their disabilities.
Hear, hear.
I'm going to list a few examples, and I know you're all familiar with them, painfully familiar. Hundreds of $millions in the developmental disability system, the multiple cuts to SSI, bringing it down to the federal income and a level at which it's not possible to exist in California, elimination of the adult day health centers, as Gary mentioned, 35,000 consumers, 7,000 jobs, people who are already in nursing homes, the elimination or restriction of Medi-Cal benefits, the cuts to IHSS and the public authorities. And while I might differ with Gary that the IHSS jobs are good jobs, at least they are jobs. The cuts to the MSSP program, elimination of the case management program, linkages, and many senior programs. Cuts to mental health services, and cuts to other things that we don't ordinarily talk about, like the huge reduction in services to students with disabilities at the community college level, where they have seen their accommodations and their assistance be lowered. And these are the people with disabilities whom we hope will have jobs in the future, but if they can't make it through college, that probably won't happen. I'm concerned that we will see, because of our own cuts and federal cuts, more people with disabilities, including seniors, going to institutions for housing, that they will be going into nursing homes to use it as housing because they have no other alternatives. We know that there are people in nursing homes now who are there because they have no other housing. And once they are there, it is very hard for them to leave. I think we're going to see more of this. And all of these cuts undermine the human and civil rights of people with disabilities, including seniors and children, which were guaranteed to them in various federal laws, including the Americans with Disabilities Act and the Olmstead decision. We will see people segregated and isolated. Every cut to healthcare services and transportation and housing and income means people are losing civil rights. They are becoming segregated from their communities. As a side note on this, as I'm sure you probably know, the state of California is relying on a provider tax for some of the huge rate increases it has granted to nursing homes since 2004. And if this provider tax goes away, I would be very surprised if there is an ability and a political will to lower the nursing home reimbursement rate. So I would be interested to see how this legislature would cope with that. Our organization is part of a consortium of citizens with disabilities, which is a coalition of about 100 national disability organizations who have issued a set of principles on the federal budget, and I put them in my written testimony. They talk about things that we've talked about here: fairness, not punishing people who are at the lowest income, the reality of what happens when entitlements are taken away. And I'm just going to read the last two, which again I would recommend to the legislature in California as well as to the federal Congress. Deficit reduction strategies must reflect a thoughtful, balanced approach and include all aspects of the federal budget in order to protect people with disabilities. Any plan must include an analysis of how it will impact people with disabilities of all ages and other vulnerable populations. The process undertaken by the Joint Special Committee should be transparent with opportunity for public input. Thank you.
Thank you very much. Appreciate it. We'll move on to, is it Nisette? Nisette Short, Senior Associate with Health Policy for the Children Now 100% campaign.
There will be no fighting at the table.
Thank you very much.
My spirits are always buoyed when we get to sit at the table together, and I am lovingly reminded that we have some of the smartest, most thoughtful, and most fiercest advocates in California on these kinds of issues. We're grateful to be able to talk with you here today because we know that you are some of our most thoughtful, fearless advocates we have, and we're happy to be able to present you with some of the information that we have so that you can charge ahead and tell our folks in Washington what needs to happen. As you mentioned, I am with Children Now, a statewide nonpartisan research and advocacy organization that works on behalf of children of California. I'm also pleased to be here today to represent a Children's Health Coalition, which includes the Children's Partnership, the Children's Defense Fund of California, the California Coverage and Health Initiatives, the United Ways of California, and PICO California. We believe that the federal deficit must not be addressed with spending cuts alone, and as we've heard previously, that a responsible deficit reduction plan must be balanced and include revenue increases. Deficit reduction based on cuts alone will undermine essential programs that provide needed support to children and families that are necessary during these financial downturns now more than ever, and provide thousands of high-quality jobs here in California. We believe that Medicaid must be preserved because it is so vital to the health and well-being of children. California's Medi-Cal is already a very lean and efficient program that provides health care for nearly 3.7 million children. It also is especially important for children with chronic health conditions who primarily qualify for Medicaid based on their disability and not on their income. For example, Medi-Cal covers more than 2 out of every 5 children in California with cancer, and 55% of all children in California with diabetes. In addition, the new census data that was released this month shows that the number of uninsured kids in California has actually increased since 2009. And given the across-the-board loss of private health care coverage, there have been significantly more uninsured kids in California were it not for Medicaid and the Children's Health Insurance Program, or our CHIP program. In other words, Medi-Cal and healthy families have buffered California's children from a more dramatic loss from health care than they would have and have been a lifeline from families all over the state. Public opinion surveys overwhelmingly show that protecting the well-being of America's children is immensely important to voters. According to the recent Bloomberg poll, cuts to Medicaid is the least popular option for deficit reduction. Therefore, we urge you to weigh in with the Supercommittee and the President and our congressional delegation about the importance of Medicaid to California and the devastation to children's health that would result if there were cuts to Medicaid and CHIP program. Specifically, we ask you to urge your federal colleagues to reject proposals that reduce federal support for Medicaid by shifting costs to states and families. Proposals that achieve savings through things like reducing the federal Medicaid match using the blended rate, which many of us have spoken about, would simply shift costs to states. That puts greater pressure on states to cut benefits or to cut eligibility or to reduce provider payments or all of the above, which would really hurt beneficiaries' access to care and just pass costs on to families. In addition, this would mean that California received less federal match for healthy families, which would jeopardize the state's commitment to this essential low-cost coverage option. Since 2008-9, California's health budget has already suffered $3.7 billion in spending cuts with an almost equal loss of federal matching dollars. As a result, families and children of Medi-Cal and Healthy Families coverage have had to pay significantly more for health care, even as they face the economic pressures of the recession. We urge you to encourage the Supercommittee to reject proposals that change the structure of Medicaid and specifically reject proposals to block grant Medicaid, especially during this economic crisis like the one we're in now and may continue for some time, when parents are losing their jobs and their access to health care through those jobs, families are losing their homes and their community supports are all drying up. The current structure of Medicaid is essential since it can be a dynamic program to take care of additional children and families that need to come onto this kind of support as they lose their jobs and their homes. As Mr. Park and Mr. Ross in the first panel also mentioned, deep cuts on caps to Medicaid, global spending caps, would be devastating for California. Facing significant limited federal support, California may have to consider limiting Medi-Cal enrollment and would undermine implementation of the Affordable Care Act and the amazing progress we've made to date in California in implementing the ACA. Finally, you should ask the Supercommittee to reject proposals that eliminate or weaken Medicaid maintenance of effort requirements. The CBO, the Congressional Budget Office, estimates that repealing the ACO's maintenance of effort requirement would cause states to restrict Medicaid and CHIP eligibility enrollment, thereby risking health coverage for an estimated 14 million children. At least 1 of every 7 would come from California. Eliminating the ACA stability provisions would not only jeopardize the coverage of the more than 4.5 million California children who rely on Medicaid and CHIP, but it would also undermine the foundation of the Medicaid coverage expansion and the California Health Benefit Exchange by 2014. Federal cuts to these health care programs to the magnitude being described and contemplated by the Supercommittee would set California back almost 15 years in improving children's health coverage and will erase progress we've made in ensuring that children grow up healthy and keep California prosperous. Such draconian policy changes would have a devastating impact on our most vulnerable children and shift significant costs to the state at a time when our state budget can least afford it. I think it's important to remember that healthy children do better in school and are better prepared to enter the workforce. We must work to ensure that their health care coverage is maintained. Thank you.
Thank you very much. Appreciate your reference to the critical importance of the maintenance of effort. The National Conference of State Legislators have appointed a committee to review the deficit reductions, and we're on the Hill yesterday meeting with members of Congress from the variety of states, reinforcing that main issue as well. So thank you for raising that. We will end with Frank Mecca, Executive Director of the County Welfare Directors Association. Mr. Mecca.
Thank you, Madam Chair. Frank Mecca with CWDA. I'm in the enviable position of going last on a panel of really bright and eloquent speakers who I think have done a great job outlining just the almost unthinkable damage to children, families, and the California economy that could result from inappropriate action from the so-called Supercommittee. So I won't reiterate their points, but I will align the county welfare directors with their concern, which are deep. With respect to the recommendations that we would make for the Supercommittee, I think the speakers before also highlighted what's most important for the county welfare directors, and that's balance. Mr. Wright pointed out how critical and fair it is that there's a balance between revenue and cuts. I think we've had, it's interesting the extent to which the debates in Washington are similar and reminiscent of debates that we've had in Sacramento. And I think Washington, like California, has a revenue problem, not just an expenditure problem. And a balance between the two is necessary. But I think with respect to reductions, it's critical that there are balance among reductions across sectors. I think it's interesting that Gary talked about the possible generational warfare, and I don't think it's, I do believe that that's a significant concern. I also think it's interesting that when you look at cuts that have been made in California, how they have disproportionately affected the same people. And many of those people are in families where children and adults and seniors and disabled people live together and suffered multiple cuts. And I think our job is to perhaps help educate those in Washington in a better way than we were able to in Sacramento, frankly, about how layering cuts on multiple programs that are looked at discreetly on neat tables with score charts really don't tell the story of the human beings that are in the families affected by those programs over and over again. The grandparent who's taking care of a foster child, the disabled senior who's in a house, on Social Security that's in a CalWorks household with a child and a parent getting child care, hopefully trying to move themselves from welfare to work. And I think it's a challenge for all of us to be able to paint that picture and provide the story so that the so-called Supercommittee can understand that distributing cuts across discrete programs doesn't necessarily distribute pain fairly across all sectors of society, not to mention distributing it across sectors most able to bear that pain. You also asked what recommendations we would make for federal action to encourage economic recovery, and the County Welfare Directors Association strongly supports the Obama administration's jobs initiative called Pathways Back to Work with respect to funding for subsidized employment. This provision of the President's jobs plan is similar to our state's successful and aggressive efforts under the prior ARA, American Recovery and Reinvestment Act, to place youth and low-income individuals into jobs. The President's initiative would do three things. It would support summer and year-round jobs for youth, building off the successful ARA program that supported over 370,000 jobs in 2009 and 2010. It would support subsidized employment opportunities for low-income individuals who are unemployed, building off the successful TANF Emergency Contingency Fund wage subsidy program that supported 260,000 jobs in 2009 and 2010. And it would support promising and innovative local work-based job and training initiatives to place low-incomes and adults in jobs quickly. The federal administration estimates that the Pathways Back to Work plan would place about 20,000 adults and almost 60,000 youths in jobs who otherwise would be unemployed under that plan. Counties and our partners in the workforce investment community are ready to help put these funds to work for CalWorks clients and for other vulnerable individuals in our communities and youth to build on the success that we achieved under ARA. CWDA recently submitted testimony to the House Ways and Means Committee on TANF reauthorization, in which we highlighted our state's successful administration of the TANF ECF. We created almost 45,000 subsidized jobs in California with TANF ECF funding. We worked with our partners in the small business community, nonprofit organizations, and chambers of commerce, and we successfully placed CalWorks and summer youth recipients in positions, many of whom were able to utilize that subsidized employment experience and get unsubsidized employment, even in one of the worst recessions in our nation's history. And so as we advocate at the federal level against the types of unfair, focused, and more draconian cuts that would decimate services for low-income people and decimate the California economy, we have something that we can ask them to do, and that is help us partner with the private sector to help them create jobs and help us create opportunities for low-income people who desperately want to work, especially given the fact that we've got an extremely successful track record that proves that we can do it. Thank you.
Thank you very much, Mr. Mecca, and thanks to everyone on the panel for your participation. Before you leave, Ms. Yamada, do you have any questions?
Well, just very quickly, seeing all of you in this array, reminds me of one of my favorite sayings, which is, if you're not at the table, you'll be on the menu. It's not a new statement, but, it means that when you are all seated around a table together, and, unfortunately, I'm very happy